Hi, I'm Robert Stevens. In the next few minutes, we're going to be running through the basics of interpreting acid-base balance. Blood gases are taken and interpreted in many different clinical scenarios around our hospitals. We're going to talk about the three parts of a blood gas, the three aspects of acid-base measurement, the four key acid-base pathologies, and we're going to work through an example. Of course, there are lots of details that I'll leave out for other talks or for you to explore on your own. Lots of people get confused about blood gases. They seem complex, but actually we just need to break it down into small parts, take it one step at a time, not overthink it, and learn the classic patterns. Okay, so let's look at a classic blood gas, the sort of thing that you would see every day. There's a lot of information here, aren't there? But we can break it down. The acid-base parts, the oxygen parts, the PO2, partial pressure of oxygen, and then all the other stuff, depending on what your hospital or what your unit has bought. Let's go back to the first bit that is the subject of our talk, the acid-base elements. These are the pH, the PCO2, and the metabolic parts, which are base excess or bicarbonate. Let's start with pH. pH is a measure of acid, and the body doesn't like acid levels, pH changing. There's a concept of a normal value, 7.35 to 7.45. As the pH goes down, that means there's more H+, more acid in the blood. That's called acidemia, and an acidosis must have caused this. If the pH is above normal, more than 7.45, for example, 7.50, that's called an alkalemia, and an alkalosis must have caused this. After pH, we consider the CO2 levels, the partial pressure of CO2. These are called respiratory changes if they cause any acid-base balance, and they reflect any ventilation change, any breathing change. If we breathe less, for example, after an anaesthetic, carbon dioxide will be harder to get rid of in the lungs and will build up in the blood, so will cause a rise in PCO2. The opposite is also true. If we suddenly start breathing more and more, we will get rid of more PCO2, get rid of more CO2 in the lungs, and so therefore the PCO2 levels, the CO2 levels on the blood gas will go down. Okay, so how does CO2 change the H+ or pH? Well, CO2 can mix with water to cause carbonic acid, which then partly dissociates, leaving an H+. And anything that changes H+ changes the pH, because H+ is acid. It is a hydrogen ion concentration. So if we have a rise in CO2 because we're breathing less, we have more carbonic acid and we have more H+, and the pH goes down. Of course, the opposite is also true. If we increase our ventilation, we get rid of more carbon dioxide, so the carbon dioxide level goes down in the blood. This lowers the concentration of carbonic acid and will lower the acid H+ concentration, which raises the pH. So we've talked about pH, PCO2, and now we're going to talk about the third one, which is metabolic. So the metabolic measurements are bicarbonate and base excess. They move by the same amount in the same direction, but they have different normal values, as you can see here to the bottom of the slide. Metabolic disorders or metabolic acid-base changes are caused by anything that is not to do with the lungs, not to do with CO2. For us, this includes hypovolemia, sepsis, diabetic emergencies, renal, heart, and liver failure. So when we think of acid-base disorders, we can think of respiratory disorders, that's due to carbon dioxide changes, or metabolic disorders that are due to bicarbonate or base excess changes. Each of the respiratory or metabolic disorders can cause an acidosis or an alkalosis. So in a way, there are four main types of acid-base disorder. Each of these four pathologies can arise suddenly, if the disease occurs suddenly, in which case they're called acute, or they can be long-term and chronic. The pathologies can be simple or uncompensated, or the body can try to compensate for the acid-base disorder to try and push the pH back into the normal range. So let's now work through an example. You see someone who's just had surgery, and this is the scenario here. They're not waking up as you'd expect, so you do a Dr. ABCD assessment and you find the airway is fine, it's patent. Breathing, the respiratory rate's low, it's about 8. Cardiovascularly they're fine, unsupported, sinus rhythm, normal heart rate and blood pressure. But in terms of the disability, they're only really responsive to pain, they're quite sleepy. Someone suggests you do an arterial blood gas, which you do. They have an arterial lining, so you take an arterial blood gas from there, and this is the result. Okay, once again, there are 3 areas of the blood gas, aren't there? The acid base, the oxygen, and all the other stuff. We're going to focus on the acid base. Let's look at those now. Notice the pH is low, the CO2 is high, and the base success or bicarbonate are both normal. So the pH is low, that's an acidemia. It can only be caused by an acidosis. The acidosis can only be respiratory or metabolic. Now, as the CO2 is high, we know that high CO2 can make acid. So this is a respiratory acidosis. We can also see that because the metabolic components, bicarbonate or base excess, are normal, there can be no metabolic disorder or metabolic part. So this is a pure respiratory acidosis. Okay, let's recap so far. In terms of the acid-base parts of the blood gas, there's the pH, the CO2, which is the respiratory part, and the bicarbonate or base excess, which is the metabolic part. We haven't talked about compensation. We haven't really talked about the details of the medical causes of each of the 4 acid-base disorders. And we haven't talked about the differences in an arterial versus a venous blood gas. Once we've worked out which of the 4 acid-base disorders it is, we essentially treat the problem. We treat the medical cause of the acid-base disorder. Okay. So in conclusion, blood gases have acid-base parts, oxygen parts, and other information to them. In terms of the acid-base parts, we need to look at the pH, the CO2, and the bicarbonate or base excess. CO2 disorders are respiratory disorders. Bicarbonate or base excess abnormalities are metabolic disorders. Of course, there are lots of other things to think about with acid-base disorders. One way to increase your learning would be to go to our YouTube channel. If you just Google UCL acid-base balance YouTube, you can find our 8 narrated YouTube talk-throughs where I discuss different acid-base disorders.